Great. Hello, everyone, and welcome to the Georgian Fahey Center for Healthcare Innovation, or CHI, first session of the 2024 or 25 academic year of the Patient Engagement Lunchtime Learning Series. The series is accredited by the Royal College of Physicians and Surgeons of Canada as a group learning activity, and it may also be eligible for credits towards requirements of other professional bodies. We have auto transcription enabled, which can be toggled on or off at any time using the captions button at the bottom of your screen. Should you have any questions or comments, we invite you to submit them using the moderated Q&A feature within this webinar, which is also located at the bottom of your screen. The session will be recorded and available for viewing afterwards, and attendees will receive this information in a follow-up email after the event. For today's session, we will learn tips and tricks for establishing a patient advisory group from CHI's very own Carolyn Shimon. Carolyn is the public and patient engagement lead, and in this role, she helps lead CHI's strategy on patient and public involvement in health research decision-making. Welcome, Carolyn, and please go ahead whenever you are ready.
Thanks so much for the introduction, Victoria. And I'd like to thank the audience for coming today to learn a little bit more about some tips and tricks for establishing an advisory group. So I'm just going to pull up my slides. This always takes a second or two, or more from the beginning. Excellent. So thank you again so much, everyone, for joining us today. It's so nice to have so many people. I'd first like to start off by acknowledging that myself and the Center for Healthcare Innovation are located on the ancestral and current day lands and waters of the Anishinaabe, the Cree, Ojibwe Cree, Dakota, and Dene-Sulinay people, and on the national homeland of the Red River Métis. And in northern Manitoba, we acknowledge the ancestral lands of the Inuit and gratefully acknowledge that our water is sourced from Shoal Lake 40 First Nation. And in coming together today, we respect the treaties that were made on these lands. We acknowledge the harms and mistakes of the past. We recognize the ongoing present-day colonial violence that is faced by Indigenous peoples within healthcare, education, childcare, social justice, and government systems. And we dedicate ourselves to moving forward in partnership in a spirit of reconciliation and collaboration. And I think as we talk today about patient and public engagement in health research, it's Indigenous research methodologies that are really at the forefront, and Indigenous scholars and researchers and communities that we should be looking to. And we also believe when we're talking about patient and public engagement that it has to be grounded as social justice and health equity lens. Because we're accredited by the Royal College of Physicians and Surgeons of Canada, I just would like to disclose that I am an employee of the Georgian Fahey Center for Healthcare Innovation. And one thing I want to say from the very get-go is a huge thankfulness of very thankful for our patient and public engagement collaborative partnership that we have at the Center for Healthcare Innovation. This group's been running since 2017 and brings together diverse perspectives from across Manitoba. And so many of our members have helped inform over the years and taught us so many lessons as we go along. So patient engagement and advisory groups. Where do we start? Well, first, just to ground us, because we are talking about patient engagement and health research, we really want to make sure that what we're talking about is engaging people around research decision-making. So engaging people with lived and living experience, families, caregivers, and communities around identifying research priorities that matter most to folks who are living with a health condition that we're looking at. People are being asked to help shape and clarify the research questions so that it actually reflects the needs and concerns of patients and informal caregivers. We're also trying to make sure that the methods that we're being that are being proposed for the study are appropriate and acceptable and sensitive to the real world context in which patients, families, and caregivers live, work, and play. Also, making sure that the research uses outcomes that have true meaning to the lives of patients and communities. Making sure that the language and the content of the information that's provided to participants in a project are appropriate and accessible, and also looking to help increase participation in research by making sure that the research is appropriate and acceptable, improving the information that's provided, and helping to include voices that aren't traditionally heard. We're also looking at conducting research, so having people with lived and living experience help in conducting research, so facilitating groups or co-interviewing, all of these different methods. Also in the interpretation of research findings, from so that we have the perspective of lived and living experience when we're looking at the research findings and analyzing, helping co-develop ways to share the research findings, so knowledge translation, some may know, and also helping to identify wider sets of research topics and ensuring that the research actually reflects the concerns and the interests and the values of people with lived experience. So that's just grounding us in the understanding that when we're talking about patient engagement today and advisory groups, it's around all of these, we would be engaging them around all of these different possible decisions that can be made in a collaborative way. So one of the first steps that we always recommend is doing a bit of an internal assessment when you're starting to think about engagement and making a decision around, should I use an advisory group? Should it be one-on-one? So it's always first important that the research team think about, to what extent does the research team believe that patient engagement will improve the outcomes of the research? What is the potential for patient partners to actually influence decision making within the research process? What's kind of the likelihood that the research team will fully consider patient partner input? And then finally, what resources are likely to be available to support patient partner involvement? And that could be financial resources, but also staff, to people on the ground who can make it happen. And then externally, I think it's really important to have conversations before you even think about pulling together or recruiting an advisory group. It's important to have conversations with people on the ground who you want to engage. So going to community events, attending meetings and talking to people, going for coffee with folks, and really getting a better understanding of the values and the expectations of people, families, and communities who are living with a health issue, what's really important to them, and then what level they expect to be engaged, right? So it's really good to have an understanding of where the expectation is on the community side of how we're going to engage. And people may choose to do an advisory group for a variety of reasons. Some of them might be to ensure that you're getting a diversity of perspectives when you're making these big decisions around research. You may kind of be falling as a team. You're thinking about the consult, collaborate, or user-driven level of engagement, and that you really want to engage a group as an advisory. You may, when you're thinking about the resources that you have on hand and the timeline that you have, it may suit better an advisory group type of situation. You may really want to create a space where people with lived and living experience can really feed off each other's ideas and grow each other's ideas. Maybe you're thinking about journey mapping together and having that type of participatory approach. So an advisory group would fit really well. Also, it might be the preference of community. So if you're doing that external assessment at the beginning and people are really saying, we prefer to be engaged as a group, one of the things is one of the benefits may be when you're doing an advisory group is connection amongst people with the same lived and living experience. So there might be that benefit of belonging and connection for those who are involved with the advisory groups. It's also kind of building off of everyone's strengths and recognizing the resiliency of people with lived and living experience when you're working together as a group. And then sometimes it's all about pushing for social change. So maybe as an advisory group, you're building champions, people who will go out and help with that social change. Why patient partners may choose to engage. So it's always good to understand too when you're talking to people who want to be involved to get an understanding about what really fires them up, what motivates them to come to the advisory group. So people may come because they really want to help people and communities living with the health issue that they have. They may want to give back to their community. They may see it as aiding and working towards improving the quality of life, not only for themselves, but also others, uh, assisting in improving the quality of care or the services, not only for themselves, but others again, and then giving the opportunity to contribute your valuable insight and perspectives on an important health topic. So getting an understanding of where people are at and what really motivates and fires them up to be a part of an advisory group. It's really important before you even start to form this advisory group to have a clear purpose for the engagement. So having an understanding of what patient engagement in the research project is meant to achieve and how patient partners might contribute to the decision making in the research process. A lot of times I say start out by listing all of the decisions in which people with lived and living experience, your advisory group, is going to be able to actually contribute to the decision making and go from there. Some of the resources that are going to be required if you do go the advisory group route is having someone who will be a liaison with patient partners. So being able to reach out, set up invites, someone who will be the person that partners and advisory group members can connect with if they have questions or if they're having difficulty navigating something. So having that point person is really important. Sometimes groups choose to have a facilitator to come and join and help with the facilitation. Sometimes groups may choose to have members of the group actually co-chair the meeting. So it's really kind of up to the group as to what they would prefer. We've had kind of both, where we've had groups sometimes want to just co-chair themselves and work with research teams to develop the agenda, but we've also had people who really would prefer an outside facilitator to come in and help with the meetings. Administrative support, super important, having someone who can book rooms and food and all of that background things that you don't necessarily think of until it comes time to meet. And then if you are doing, say, a hybrid or a online engagement, your advisory group is meeting virtually, having somebody who can assist with audio, visual, and tech support as well will be really important to have on hand. Someone who can help other members if they're having difficulty online. So having a point person for that as well. For resources, so thinking on the financial side of things, thinking about compensating people for their time and their insight and their contributions to the project. So we're huge advocates to compensate patient partners for all that they contribute. Food and beverage, one of the biggest things with advisory groups is coming together and having food together can be a really amazing relationship building aspect of the engagement. Thinking about transportation and travel, so making sure nobody has to incur any type of expenses just to contribute. So thinking about taxi vouchers, bus tickets, parking passes, all of that. Childcare and respite. So if your partner is a caregiver, thinking about how to make sure that the person they care for has support while they can, so that they can fully contribute. Accommodations. So if people are coming from out of town, thinking about making sure you find accessible hotels or places to stay. The technology can sometimes be if people don't have access to devices, can we supply people with devices? Those types of things, thinking about. Sometimes even renting a room in an accessible space may cost some money. And then materials, so printouts and mailing materials. Sometimes your partners will want hard copies of things ahead of time to review versus sending PDFs by email. So really thinking about those types of things. And we have at the Center for Healthcare Innovation, we have a neat little online budgeting tool that people can use. And we can share that link later on, and I'll help you build that budget and make you and have you start thinking about all that it might entail. So when you're starting to think about recruiting for your advisory group, some of the questions that I always kind of um, tell groups to think about is first of all, thinking about who is affected differently by the health issue. And then who has different access to healthcare services associated with this health condition? So not just thinking about um, geographical barriers, so thinking about urban and rural and remote, but also thinking about systemic barriers such as facing transphobia, racism, colonialism, ableism, sexism, all of those different barriers that people might face, and making sure that you have a diversity of perspectives around the table who can speak to that. Um, where along the health journey patients are at. So sometimes you'll have people who are newly diagnosed and people who have been living with a health issue for decades. And so, really thinking that through as far as the dynamics of the group and having an understanding ahead of time is really important so that you're devising a strategy that will work. Also, how am I going to ensure a diversity of perspectives are on my advisory group? So thinking through different ways to do activities where we meet people where they're at and perhaps conduct our advisory groups within community settings, and how do we start building those relationships? And sometimes it's about building relationships before we even get to the actual advisory group activities. We do sometimes if you want to do a call out to recruit people with lived experience for your advisory group, some of the suggestions is having a project title, a lay language overview of the engagement opportunity, a list of some of the roles and responsibilities that will be involved, thinking about the time commitment and the duration, being very clear in your call out about honorarium compensation, but also reimbursement, and then contact information. So one person that they can reach out to if you have questions or concerns. And again, we have a one pager that gives you a little bit more of what you can include in a call out on our website, which we will definitely share a link to. And different ways to recruit. Sometimes it's connecting with other health researchers who have engaged people with lived and living experience in the past. Sometimes it's talking to healthcare professionals in the field and clinicians. Sometimes it's about connecting with healthcare consumer organizations, perhaps visiting a support group and conversing with folks about the opportunity. Also really expanding, we think, looking outside or thinking outside of the box as far as recruitment. So also connecting just community organizations through social media, newspapers, radio, talking to other people with lived and living experience, or community leaders, and seeing whether they can identify some individuals who might really be interested. You can think about holding information sessions for people to come and just ask questions, and also thinking about attending events that community are putting together just to come and chat with them a little bit about your project and see whether they might be interested in joining. As far as you can ask for an application, and this can be either in writing, but also in just in speaking, whichever people feel most comfortable with. And in an application, you'd probably have the contact information. You could collect equity, diversity, inclusion information. You could ask why you're interested and what you feel you bring to the table and some of their skills and experiences, availability, some of their preferences on how to engage and where they would like to engage. Sometimes you get great suggestions on community organizations and places where you could engage. And then as far as interviewing or just connecting, the formal interview thing I don't necessarily think about, but more going for coffee with people who have expressed an interest in just getting to know each other better to see if it's a right fit. So just introductions and an overview of the project. Would you be willing to tell or feel comfortable sharing a little bit about your health experience? What motivates you? Why are you interested in becoming a member of the advisory group? Do you have any experience of being part of an advisory group before? Or have you had any experience engaging in research project? And that's not necessarily um, the most important thing, but just understanding. What would you say are some of your special interests or unique life experiences or skills that you could contribute to an advisory group? What kind of commitment could you make to this position? Understanding, of course, that people along their healthcare journey, there may be ebbs and flows, and that understanding that there may be times people have to take a step back, and that is something that the group can accommodate. Are there any days or times that work best for you? Anything else that you want us to know, or anything else you didn't get to say? And then questions for your yeah, if they have questions as well. For online engagement, there's some questions you can ask a few steps more. So, how do you feel about engaging as a group online? Um, Wanting to make sure that people are fully able to participate. Can you, of course, just asking, can you let me know if you have a device with an internet connection? If not, that's something that the research team would have to think about. Are you able to use audio and video on the device that you have? Are you comfortable using Zoom or Teams, or is there another way that you prefer to connect online? Are there any health or ability restrictions we need to be aware of in order to ensure we are meeting your needs when we're meeting online? Um, Oops, sorry. And if we were to meet online, does that mean your availability might change? And what are the best times? Do you have a safe space within your home where you feel comfortable to freely share your thoughts and ideas when you're online? And if not, I know in the past we've done things like set up rooms in community centers nearby where someone lives, where they can use a computer and join the group online. So finding spaces, comfortable, safe spaces to be able to engage. Do you have any suggestions for ground rules when you're meeting online? Do you have any questions about this? And really just getting a good understanding about any concerns that there might be to meeting online. Some additional questions, and one of our lovely Ogai, who's the one who came up with these wonderful questions, but really making sure that people are able to fully participate. So even talking to people about what kind of space makes them feel more at ease and comfortable, whether it's around lighting or the way we sit and all of those types of things. Do you have a preferable space where you feel most comfortable to share your thoughts? So sometimes people might actually suggest a community center or a place where they've engaged or been in the past where they feel comfortable. Do you prefer to have a support person with you? So that is also an option for patient advisors. If there's a support person they would like to have come with them, making sure there's space and acknowledgement for that. Do you have an item that you would want to bring that helps to make you feel supported? Would you want us to bring any of the following items? And this is something we've learned. Our lovely collaborative have taught us recently about this. So bringing things like coloring items or Play-Doh or puzzles or fidget items, just to use while we're meeting and talking. So having those available. And do we need to be aware of any words or phrases, items or spaces that may elicit strong emotions? So for example, things that can be triggering. So just really talking through that to make sure that the space is as safe as it can be for people to engage. An orientation, this is kind of an outline of what a potential orientation might look like. There might be some introductions and acknowledgements, then moving into icebreakers, an overview of the project, the opportunities in which the group can engage, talking about confidentiality, compensation. Now, for compensation, I would say these are more one-on-one conversations. So you can mention it in the orientation, but each person, it would be important to have a one-on-one conversation about compensation, how they prefer to be compensated, and so on. And if they have some concerns about the compensation aspect. How do we want to communicate? What's the best way to communicate with folks moving forward? And then some of the next steps that will happen. Some of the training that an advisory group might like to might like to have, there could be a patient engagement 101, a session on trauma informed engagement or anti-oppressive and anti-racism approaches, a session on cultural safety or conflict resolution. There's lots of different online modules as well. So the CIHR SPORE Foundations in Patient-Oriented Research curriculum is something that partners can access. Each SPORE support unit in every province and territory. So SPORE is the strategy for patient-oriented research, which is a national initiative. And each province and territory has a support unit. And a lot of times they offer some really good free training that partners can engage in. OCAP principles, CIHR, TCP, S2, so chapter 9, or even here in Manitoba, we have the Indigenous Cultural Safety training as well, in which members might want to take these trainings. And then, of course, we have our lovely Valuing All Voices framework, which is a neat little tool that you can use to take a look at the different we engage different communities to better understand what makes a good relationship when it comes to engagement. And some of the key themes were understanding and acceptance, trust, relationship building, self-awareness, education, and communication. So building this into the into the activities of the advisory group are definitely essential. And we have our lovely Readiness to Engage workbook that people can access off of the Center for Healthcare Innovation. And this gives some questions, some critical reflexive questions that both researchers and patient partners can work through both individually and then as a group that will help kind of start people thinking about their own social location and position and how that might inform the way they're looking at a certain issue and how they may even come together to make decisions about research questions. So it's a neat little workbook. So when you start mapping out your engagement strategy, the first thing I think I talked about before was what research decisions can the advisory group members inform? Looking at the project timeline, when do these decisions have to be made? What possible participatory approaches might we use to engage the advisory group where they are at? So that really means sometimes a conversation around outcomes where we might not, depending on the group that you're engaging, say if you're engaging a group of youth, it might not look like a traditional research or advisory group meeting, but it might be going out into the community and taking photographs of outcomes that we think are important to include in the research study. So really finding creative ways to meet people where they're at and to open space for people to be able to meaningfully contribute to the decision making. And then how will we handle the in-between times? A lot of research projects during the data collection phase, there might be a lot of time that elapses. So, how are we going to keep the relationship going? And that might mean having a meeting where we just connect and have food together and talk, just to keep that relationship going, finding ways to keep communicating with one another during the in between time so folks don't feel like they just the team dropped off the face of the earth, but rather that we're trying to make effort to keep connected. Some of the foundations, I guess we would say, as far as advisory groups, is really the importance of icebreakers. I know, I know a lot of people are like, oh, icebreakers, but they're really important at the beginning of each meeting because it really helps us to connect on more of a personal level. I know when we have advisory groups that have both patient partners and researchers and healthcare professionals and policymakers, when you have an icebreaker like what's your favorite thing about fall and go around, there's just ways of connecting across different perspectives and views. It's really important to have conversations from the very, very beginning around safe and brave spaces to kind of set the tone about how the interactions are going to roll out and some of the expectations, um, as far as the way we're going to interact with one another, and building guiding principles, which I'll talk about in a minute. You can create a vision statement as a group as well. Um, Thinking about a justice, equity, diversity, and inclusion statement. One thing that we always recommend is that you have a list of counseling supports and resources available for folks that should something happen when they're telling their stories, should it bring up some strong feelings, that we make sure that we have resources in place, so that people can get the support they need after the meeting. And that includes to debriefing with folks after the meeting to just see how things went, what could be done differently, and so on. And then always a wrap up, our favorite, our favorite wrap up here, especially if it's a heavy topic and you want to have something future oriented and also have people build some self care into their lives. Our favorite wrap up is name one good thing you're going to do for yourself, either today, tomorrow, or this week. And so people might say, I'm going to go for a walk, I'm going to have a cup of tea, all of those types of things. So just having everyone say something that they're going to do for themselves, moving forward. And it's kind of a nice way to end. And sometimes you get great ideas from other people in the group as well as to some self care. A few other pieces of advice. I really recommend having one research decision per meeting. I think a lot of times if you try to cram a bunch of different research decisions in one meeting, it can get confusing, but also you run out of time, and things start falling into the online space. By really dedicating one research decision per meeting, you can really tackle it and have space for people to meaningfully contribute to the decision. Think about participatory approaches that will allow members to fully contribute their insight, knowledge, and expertise. So again, it might be arts-based. You might come up with different ways of still having that conversation and making decisions together, but making it in a way that's accessible and people can fully contribute, um, in the conversation. So always meeting people where they're at. So a sample first meeting of an advisory group would be something like this, having some introductions, some acknowledgements, an icebreaker, having a safe spaces conversation, talking about the purpose of the engagement, maybe having a little break, then an overview of the research, some opportunities to engage, and then some of the benefits of engagement that might come out, but also preferences of folks as well. And then talking about next steps. What are the best ways to communicate as a group? What do we want to do next? So welcome and acknowledgements. You can do an icebreaker activity. This one we like for the first meeting, and it's please take a moment to look at this photograph and reflect what it means for you or as something that stands out to you. And then you can, at the end, when everyone has taken a look at the photo and said what they see or what stands out to them, you can talk about how we all see things differently. We're all looking at the same photo, but we have different perspectives. And what makes it so amazing when we come together is we get all of these different perspectives. And that's what makes it strong as an advisory groups, our decisions. The safe spaces conversation, the way we typically have it is having a conversation first about what does physical safety mean to you, look like to you, and feel like to you. And every time we have this conversation with a group, it's different because people define safety and safer spaces very differently. And it's important to have the conversation with the group as a whole. So people may suggest uh, different environments to meet or what they would prefer the space to look like or what physical safety means to them. Then thinking about emotional or psychological safety, what does it mean to you, look like to you, or feel like to you? Again, folks may be talking about things like let's use strengths based language, let's really support resiliency and look from a positive perspective instead of this issue. So having that conversation. And then talking about what does cultural safety mean to you, look like to you, and feel like to you. And there can be conversations um, about different ways in which we communicate and how what that looks like and things that we should expect or acknowledge throughout the conversation. And then spiritual safety, what does it mean to you, look like to you, and feel like to you? So that might mean integrating ceremony or integrating certain elements as part of your advisory group meeting that would make folks feel safer. And then what happens when you have this conversation, you start listing out all the different ways, you can kind of develop guiding principles for your advisory group. And what that means is you actually end up having this shared language in which, if there's ever um, something that happens within the group that people don't feel good about, they can actually say, can we look at the guiding principles? And it's a shared language that we need to stop and we need to address something that's going on within the group. And so it really helps everyone to identify when there's times that we have to have and maybe lean into some of the tougher conversations that need to be had within the group. And sometimes I would say we look at the guiding principles on a regular basis. We add items to the guiding principles as they come out. So continuously having that at the forefront. And our collaborative partnership definitely have their own um, guiding principles that they work around. And the good thing about guiding principles is it also really clarifies what we mean when we say safety versus comfort. And so, in that way, just setting the tone and expectation that if someone says something harmful, um, they will be called out in the advisory group, and that may be uncomfortable, but it's not unsafe. So that we are a space where you will be challenged or called out if you say something that's harmful to someone else. So if you say something that's ableist or racist or transphobic, you will be called out in the group, and that's not unsafe. It just makes you feel uncomfortable, but we're going to rise to the occasion and we're going to lean into those difficult conversations as a group. So setting that expectation out front so we know what's going to happen if that does happen is really important. So the purpose of engagement when you're having your first meeting, talking about why patient and public partners were selected to participate in engagement, some of the rules and expectations, not only of partners in the advisory group, but what can you expect of members of the research team as well? Some of the anticipated outcomes of some of the engagement activities, What does the timeline look like? What might some of the potential challenges be? What's the scope of the work? So getting a better understanding and some of the benefits for partners as well. Lay language as far as when you're gonna introduce kind of the general theme of the research study, brief description of the background and how partners play an important role in the research, and really elaborating on opportunities to engage. So, what decisions will partners in the advisory group be involved in making? How these contributions will be used, and who will make the final decisions? The commitment that's needed, so frequency and duration of meetings. Again, overlying a little bit of the compensation and reimbursement, confidentiality and opportunities, and then some of the benefits and preferences. How does engagement benefit partners? And then what are your preferences as far as meeting, location, accommodations, dietary, communication, and facilitation? So a lot of times members will already have contributed that, but we can still kind of have that conversation. And then the one nice thing, so your final thoughts and name one nice thing that you're going to do for yourself. So that's kind of what an initial meeting would look like if you were to have your first patient advisory group. Some of the additional activities that you might want to add on as you're building that relationship is developing a vision statement. We like to use the Adapted Tree of Hope arts-based activity where the ground is the valuable experiential knowledge brought by members. The roots of the tree is what we think are the root causes of the health issue. The trunk is where you dream big and what kind of supports you'd like to see. And then the branches are looking at both the roots and the trees and constructing our group vision. And then a justice, equity, diversity, and inclusion statement. So for justice, we're talking about dismantling barriers. When we're talking about equity, allocating resources so everyone has access to the same opportunities. When we're talking about diversity, differences between us based on systems of power and oppression, and then inclusion, fostering sense of belonging by valuing and amplifying voices traditionally less heard. So you can go through each of these elements with the group as well. So participatory approaches, if you are doing a priority setting within one meeting, so one of your first meetings is a priority setting, you could use a ton of different priority setting or a ton of different participatory approaches, whether it's a nominal group technique or a journey mapping, observation of existing services, democracy we use a lot, or drawing and storytelling and writing. For the research question, you can have discussion groups, you can have people interview one another, you can use participatory decision making. For the outcomes, you can think about writing or drawing or storytelling and taking a photo of outcomes that are important to you. We've done the Tree of Life, that arts-based activity where the branches are the desired outcomes. You can use an appreciative inquiry technique to come up with outcomes. For methods and design, there's all sorts of cool ones like you could do a citizen jury technique or charrettes, do some little study circles or do participatory design. For participant materials, you could use whiteboards, you could do role playing or conversation circles and open spaces. And then for data collection, members of your advisory group could be co-facilitators, co-interviewers, or do patient observation as part of their involvement in the data collection. And the interpretation of findings, sometimes we do the storytelling. So what story do these findings tell us? Do they align with our own personal story? And what story is not being told? And then for knowledge translation, we can have focused conversations or discussion groups are using participatory design to come up with a method to disseminate our findings. In evaluation, again, appreciative inquiry or digital storytelling, even interviewing one another as well. And we have a whole little methods of engagement book that you might want to take a look at as well, that we'll share that link too. And so potential outlines, this is what a potential outline for your advisory group might look like. I always say meetings 1 and 2 should be purely relationship building, which I know is a lot of investment, but I think by investing in relationships at the early stages, it's really important. So you can do relationship building, guiding principles, the vision statement, maybe a justice, equity, diversity, and inclusion statement. Meeting 3, you could start looking at priority setting and developing your research question. Meeting 4, you can start thinking about how you're going to evaluate the engagement upfront. So, what looks like success? How do we want to measure things and how do we want to evaluate? Meeting 5, you can dedicate to designing, so doing study circles or asynchronous. So, thinking about how you're going to design things. Meeting 6 then can be your interpretation phase. Meeting 7 and 8, I always say 2 meetings for knowledge translation, and we've learned this over time because the first one, you're kind of thinking about what that will look like. And typically the second meeting, you're going to get a protocol or an example of what's come out of the first meeting that you can review. And then meeting 9, wrap up and next steps. You can have a party, you can celebrate your work or start thinking about the next grant that you're going to apply to. So these are all the additional conversations. Sandwiching each meeting with an icebreaker and a wrap up is really important to build relationships. Communicating all the time about how the advisory group is informing each research decision. At the knowledge translation phase, as I was saying before, it usually takes more than 1 meeting, so put 2 down, I would say. Touch on guiding principles on a regular basis. Consider mid-review evaluation to make sure that people are feeling good about engagement, feeling heard and valued. Have regular touch base and debriefing with individual advisory group members. And really foregrounding, a part of trauma-informed engagement especially is foregrounding choice. So having the advisory group make as many decisions about the way they want to engage, how they want to be engaged, and what they want to be engaged around. Um, and just really the primacy of relationship building is first and foremost, even before the research itself. And the important qualities that to have when you're doing this type of work is really just having courage and being honest with folks, being willingness to model things. So being able to call out folks and lean into difficult conversations, being fully present and actively listening, caring is important, belief in group process and collaborative decision making, being open, and non-defensive-ness when coping with criticism. So sometimes you'll get feedback like that wasn't a great meeting and how to improve it. Self-awareness is a really important one. So doing critical reflexive practice on a regular basis, sometimes even journaling after a meeting for your own sake or having someone you can debrief with as well. The willingness to try new things and experiences, the belief in the strength and resiliency of people with lived and living experience, building in self-care for everyone, including yourself, having a sense of humor, being creative when it comes to how are we going to engage around this decision, and then personal dedication and commitment. So those are some of the important qualities to have. And questions. I can stop sharing, right? That was a lot of information for it's always a whirlwind.
Thank you, Carolyn. We do have a couple of questions that I will moderate for you. Am I frozen?
Nope.
Oh, okay. I froze on my end. So I also invite you all to pop in questions. You also have the option to ask them anonymously if that would be more comfortable for you. So our first question is, we have gotten feedback from patient partners that they feel our organization should not spend healthcare dollars on food and beverage for these councils. They would rather these funds be put into patient care. What are your thoughts?
Oh wow, that's a that's a great I would say that would have to be, I would hope that would be everyone agrees on the group that that's the way that they rather not do the food, because I think there is an aspect of engagement and relationship building where food and eating and having conversations and sharing with one another is a really good way to build relationship. So I would say, have consensus with the entire group that that's what they want, and just recognize their the value of an advisory group as far as informing either health systems decision making or health research and everything that they bring to the table as well. So just keep letting them know that they are an integral part um, of that as well.
Next question is, would you recommend onboarding calls prior to orientation?
Onboarding. Oh, yes. Yeah, sorry. I think it would be really important. I think it's really important first to have one-on-one conversations before bringing everyone together to do an orientation session. I think um, there's a lot of conversations that have to be done one-on-one. So things like compensation, what's the best way to compensate you, any type of special things that you require that we need to think about when we come together. So having those kind of onboarding conversations ahead of time, I think is preferable before the orientation where everyone comes together.
Next question is, what kind of frequency do you recommend for follow-up meetings? Meaning, how often should we be in touch, either via email, phone calls, or next meetings?
It's so interesting. It always depends on the project because we know some projects move a lot quicker than others. I know when we have like a year to develop an entire research project, a lot of times it will be kind of on a bi-monthly basis, 6 meetings and coming together. Things that we did during tough times, like during the pandemic and so on, is we sometimes had um, a come and eat lunch together where we ate lunch together online and just talked about personal stuff, and it was just completely so we could just connect with each other and see how everyone's doing. And that would be in between those big research decision making meetings so that we kept that conversation going. I know some teams do newsletters. Some people will just give people a phone call to check in on how they're doing and just let them know where things are at. But really, I think it's just important to periodically check in and let people know where things are at, because sometimes we know collecting data might take way longer than expected, and just letting people, part of the orientation too is communicating that, right? The length of time that it sometimes takes, that research can be slow, and just letting people know that, just so ahead of time you have like a general idea of what it's going to look like.
Well, and given all this information, what is the appropriate time to allot to a meeting?
Ooh, we have conversations about this all the time, because we've had so many different experiences. One of the things that we found from our partners is, especially if it's online, that 90 minutes is like the max out. Where a lot of our community partners who may be living with different health issues and so on, 90 minutes if you're online is probably enough. And that's what we've been doing even right now on a hybrid basis. We've been doing 90 minutes plus a half hour for food ahead of time. So those who are joining us online don't have to come for that half hour, but those who are eating in person can do that half hour. So allotting, I guess, in total 2 hours. Um, the feedback has been that 90 minutes seems to be the top out. And I know I think if you have big decisions that you have to be made and it's going to take a while to converse, I think touching base with your advisors and seeing whether or not they might be able to do 2 hours if that works, and just really having that conversation.
Um, a bit of a follow-up to some of the comments you've made during the question period. How do you justify the social meetings to funders?
Ooh. I see it as part of the relationship building aspect. I think we can't engage people with lived and living experience around research without building the relationship piece and building trust, because of a lot of things that have happened in the past. It's really important to dedicate time to that relationship building in order for trust to be built and for us to truly be able to collaborate in a meaningful way. Um, I think it's of utmost importance, and I think even reading a lot of patient-oriented research and patient engagement, it really denotes that it is about the primacy of relationships come first and the research comes second. And so as much as much as I think it's so important if you're going to collaborate, and I feel like if you were on a research team with other researchers, you would go for lunch or coffee or those types of things, and you would build that relationship. So the same should be done with our community partners, getting to know one another and staying in touch.
We probably have time for a couple more, and we do have some. This is a bit of a tough question.
Oh
What
boy.
if there is little to no budget for compensation of patient partners?
That's always a tough one. I guess the biggest thing is being open and honest about what you have and what you have as far as funding. And if you don't have funding for compensation, really thinking through what other things might be able to show your level of appreciation for what they're doing. So things that we offer on top of compensation are things like we'll write you a letter of reference, building different skill sets like being a co-chair for a meeting, that might help your resume, or finding different ways, maybe opportunities to attend a conference, or maybe opportunities to co-present material, finding different things that would be meaningful to folks. We do things like certificates of appreciation. So even when we do compensate people, we want to celebrate all of the value that they bring to the table. Even things like sending people birthday cards and really or like, telling people we're thinking of you when we know they're going through things. Those little aspects of making people feel appreciated and heard and valued. And you can even talk to people when at the very beginning, when you are onboarding, to say like, what types of things make you feel appreciated? What types of things make you feel valued and heard? And really trying to figure out ways to integrate that as much as possible. If there is no, I mean, we always recommend compensation, but I do understand sometimes students, you don't have the funding and those types of things. And we also, CHI has a preparing for research by engaging patient and public partners. So we do have a little pre-engagement award for at the very early stages of engagement when you don't have a big grant or funding to engage. It's a little pot of money to help you do that engagement at the priority setting, research question design phase. So keep an eye out for that.
And that will launch in February of this following year. We are out of time, but am getting a couple of really good questions, so we'll quickly pop them in, but please do not feel that you have to stay. The recording will be available for this session. On the topic of the compensation and other ways to show appreciation, a question of wouldn't reinforcing patient engagement and partnerships to this extent introduce a greater degree of bias in the research data?
That's a good question. I don't think so. Like I feel like you, especially when I talk about meeting people where they're at, it's really finding ways to make decisions around research. That isn't saying that partners, that advisory group members have to be researchers at all. So we've done all things like we constructed a research question by using puzzle pieces that had different types of data we have access to, and we built puzzles together. So finding different ways to have people be able to share their story, have space to share, for us to witness and bear witness to their story, but creating spaces that aren't necessarily like your traditional research meeting, but rather you want to have that diversity of perspectives, people being able to meaningfully inform research decisions, and recognizing that as researchers we do come with bias. So when we are doing research, we even quantitative research, we're still informing what numbers are, like what we're looking at, how we're designing the question. All of those things, our own social location do influence and bias us as well. And so bringing in a diversity of perspectives actually helps to widen that and really address some of those things. And really look at questions that are important to people who are actually living with a health issue.
Amazing. And last but not least, and then we'll close it out. What is your take on using school grounds as community engagement spaces?
School grounds. Oh, so university spaces and things like that. I know a lot of times when we have conversations with folks, hospital settings, healthcare settings, and even university settings aren't necessarily the most comfortable spaces for partners to meet. And so it's really important to have that conversation and to say, I really want to make sure that we meet in a space that you feel comfortable. And there are times where we've had partners say, you know what, I don't mind meeting at a university setting or a health system setting, but I think it's really important to offer choice as part of the trauma-informed approach, always offering choice to folks and really having a say in where we meet. A lot of times community organizations, people may feel more comfortable at places that they know and feel comfortable, or that, and just having that willingness to think through which space works best for partners to meet.
Awesome. So we will close up now. I just want to take a moment to thank Carolyn for our wonderful session today and all the folks still remaining that are attending today. You'll receive a follow-up email with further information on how to access the recording as well as the slides. And we will be back on October 29th for a special session in collaboration with Shared Health, which will be for Patient Safety Week, in which the theme for this year is to consider what we think of when we talk about healthcare harms. I'd also like to invite you to complete a quick 2-minute survey of your experience in this event, as it's super great for us to know your feedback and what kind of content you might be interested in seeing in upcoming sessions. And this survey will give you also the option to sign up for a newsletter if you want to stay up to date on the series and other events we host. And this survey will be prompted up by Zoom once you close this webinar. I'd like to all just take a moment to thank you all again for joining us, and please don't hesitate to reach out. There are emails located within the webinar related confirmation emails you've been receiving. And I wish you all a wonderful rest of your day.
Thanks so much, everyone.